I need a big sip of coffee for today. Good morning, mommies and daddies of the YouTube world. I do want to do a little bit of an intro before I get into my vlog for today. Yep, I am in my PJs. Remember in my intro video when I said, sometimes you will see me making videos in my pajamas. Today is one of those days, but that's probably going to be changing for the most part because in my intro vlog, I said I spend 95% of my week in my pajamas unless I have a doctor's appointment or need to run to the grocery store. My toddler's throwing her toys on the floor. I'm doing something a little bit different. I'm heading back into the corporate world today. I'm actually going back starting today in the afternoons. I'm just doing it part-time just for a couple months because it's just, frankly, it's a lot easier on the finances. So, yeah, this is probably, the pajama vlogs are not going to happen very much anymore, or if they do, it's going to be in the mornings before I get ready for work. So, hence the giant sip of coffee. I'm going to need it today. Alright, so today's video is going to be my C-section recovery tips. So, if you are unfamiliar with me or my history, I invite you to go over to my personal channel and watch the latest video. It's called The Big VBAC Discussion. I am very much interested in a VBAC, and that video gives you all the reasons why. It tends to be a little bit longer of a video than I normally do, so get some snacks or a drink or something before you watch it. But while I'm very much interested in having a VBAC, I'm very determined. I realize that I may end up with a C-section. And also, if you know my history and you know how horrible my recovery was, then this is like a little list for me to avoid such a horrible recovery. And, you know, some things are out of my control. A lot of the things that happened to me were out of my control, but some of them I can fix. I can make better judgments and decide to do things a little bit differently that would help my recovery. So I have a little list here that I'm going to read off. Alright, so my number one tip is do not avoid your pain medications. For me, I had a spinal block, and when they give you the spinal block, they also inject some type of pain medication. So when the freezing wears off, you're not like, oh my god, it hurts all of a sudden. You have some pain medication in there, and I think it lasts for about 12 hours. So you tend to feel good, and you feel like you don't need your pain medication. They usually start you off with something like a Tylenol or Tylenol 3 and some naproxen or Advil, some sort of anti-inflammatory, before they tend to give you narcotics. I cannot handle narcotics. Anything that is any higher than like a Tylenol 3 or a ridiculously low dose, like for example, I was prescribed 1 milligram of Dilaudid, and because I decided I don't need to take my medication because I'm feeling okay, like the nurse will come in every 6 hours, or every 6 hours for the Tylenol, and then like every 12 for the anti-inflammatory, something along those lines. And I would send her away because I felt like I didn't need them. Well, once the freezing wore off, and once the other pain medication that they injected into me wore off, whoa, I needed the narcotics, and I ended up taking 3 milligrams of Dilaudid, and it doesn't sound like a lot, but for me, it actually interfered with my breathing. It scared the crap out of me. I was high as a kite. I didn't understand what was going on or what I was saying. So that's not something that I'm going to be doing. When the nurse comes in to give you your pills, take your medication. My second tip would be to use a pillow to support your incision when you're getting off the bed, when you're sneezing or coughing. Nobody told me about the pillow trick. So anytime I got off the bed to get up to go to the bathroom, I literally felt as if my body was being ripped apart. It hurt so bad. Definitely use a pillow. My third tip, I think everybody knows this no matter which type of birth you have, but if you are having a C-section, make sure you wear extremely loose-fitting clothing and underwear. You don't want your little bikini brief underwear. You want the big old granny panties because you want something that comes above your incision. You know, truthfully, and TMI, this might be a little on the embarrassing side, but I use like the Depends adult diapers. I used them for my duration in the hospital because I knew that I was having such a bad recovery and I was having such a hard time getting out of bed that I might not be able to get to the bathroom as quickly as I needed to, and this provided extra coverage, and they were super comfortable, and I plan on using them again actually. My fourth tip is stool softeners are your friend. Take them the second you deliver your baby, because you might be on narcotics or any other type of pain medication such as their Tylenol 3 or regular Tylenol and Advil, but you'll be taking so much of this stuff that you might have a hard time going to the bathroom. And don't be afraid of your first postpartum poop. As long as you're taking your stool softeners, and it's not something that's going to give you diarrhea, it's just going to make it much softer and easier for you to go to the bathroom. Don't be worried about it. Just sit back, let gravity take over, let gravity do as much of the work as possible. Don't be afraid of it. But honestly, stool softeners are your friend, and I think even if I have a vaginal birth, I'll be taking them the second the baby is out of the womb. My next tip is lift nothing heavier than your baby. It's not because you're recovering from major surgery and you might be tired and it might take you a few weeks to feel better. It's for one very important reason. When you have a C-section, your uterus is stitched back together. That's why they tell you lift nothing heavier than your baby, because anything heavier than your baby runs you the risk of actually rupturing your uterus. You don't want that. That's scary. They have to open you back up and fix you with surgery. Do you really want 2 surgeries? No. Follow the 6 weeks recovery. It doesn't matter if you're feeling great in 2 weeks and you feel like you can lift that stroller out of the back of your vehicle. Stop. Don't do it. Remember, you have stitches internally on your uterus, not to mention on the outside. That stuff needs to heal. My next tip is something that I'm definitely going to be doing. I didn't do it the first time. We had a few people over that cooked us meals, but I need something for when those people are not here cooking us meals, so we are going to do freezer meals. And I think no matter which way you deliver, freezer meals are a godsend, and that's something that you should do. My next tip would be get a belly binder. I know some hospitals actually do provide them. My hospital unfortunately doesn't, and I do think that it could be beneficial no matter which way you deliver. The main reason for a belly binder is it helps really support that incision and makes it getting around, getting off your bed much easier. My next tip is obviously for those of you who are first-time mothers and don't have other kids at home, but sleep whenever possible. Remember, you are recovering from major surgery, and that's going to make you really tired and really weak, so sleep whenever possible. If you are having your second, third, or fourth child, get some help and get lots of it, and don't be afraid to ask for help. My next tip is probably my most important tip would be take iron supplements right along with your prenatals. Obviously, please check with your doctor before you do this, because you might have an awesome hemoglobin and an awesome iron count, and the prenatal that has the iron in it might be enough for you. But for people who do suffer with anemia problems and are looking at getting a C-section, or you're having a VBAC and you're looking at the possibility of having one too, I lost a lot of blood with Ellie, and my hemoglobin number was crap to start with, and so was my iron count. So I'm going to start taking more iron, so if I do have another bleeding episode, that I have extra reserves. Obviously, bleeding can happen with vaginal delivery. You can have a hemorrhage or something like that. So I think that's beneficial no matter which way you deliver, but especially with the C-section, because you're more at risk to lose more blood. So I hope you found my tips helpful, and I will talk to you for next week. Bye-bye.